Psychology in Film, The Soloist. In the movie The Soloist, Nathaniel Anthony Ayres Jr. grows up a talented musician with a love for Beethoven. Starting from a young age, Nathaniel dedicates his life to the cello, eventually matriculating at Juilliard after years of exhaustive, even obsessive practice. Ayres becomes increasingly preoccupied with rehearsal, even when out with friends. This becomes more problematic as he begins to hear voices in his head, implanting delusional thoughts and dictating his actions. 2 years after enrollment, Nathaniel drops out of Juilliard to live with his sister, where he fails to adhere to medical treatment. During a violent delusional episode, Ayres runs away from his childhood home and begins his life as a vagrant. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. They tend to demonstrate disorganized thoughts and speech, and normal functioning is disturbed. Though comprehensible, Ayres' speech is disorganized and lacking coherence. His sentences are often unrelated to one another, although the words do tend to connect. Additionally, Ayres experiences delusions of persecution. The voices he hears in his head urge him to hide and escape the perceived evil in the world, and try to convince him everyone he encounters is judging and planning to kill him. At one point, Nathaniel is convinced his sister has poisoned the soup she is trying to feed him. He then force-feeds her the same soup in an effort to kill her before she can kill him. Years later, the feelings of persecution return in the midst of a cello recital, to which he responds by fleeing the stage in self-defense. Nathaniel lacks grossly disorganized and catatonic behavior symptoms. Grossly disorganized behavior is classified as when the patient behaves in ridiculous and immature ways or is agitative in an unpredictable manner. Catatonia is when the patient is disconnected from their surroundings, whether they are highly resistant to following instruction, hold an abnormal posture, are unresponsive verbally and expressively, or repeat a motor function purposelessly. Although Nathaniel is provoked into violence on several occasions and exhibits other odd behaviors, his lashing out is predictable given the situations in which they occur, and none of his other mannerisms or actions align with the descriptions of these symptoms. In the movie, Nathaniel Ayres' treatment plan consists of a form of support network through Steve Lopez. This improves his quality of life both by providing him with a meaningful relationship and by helping him find a place to live. However, this is not the optimal treatment plan. Nathaniel should begin treatment by meeting with a certified psychiatrist. This psychiatrist should work with those close to Ayres, such as Lopez and Jennifer, his sister, to form an educated support network. To treat the schizophrenia itself, he should be prescribed an atypical antipsychotic medication. It is important a strict schedule is maintained with these dosages in order to maximize their effectiveness. Ideally, the outcome of the treatment plan would be a better quality of life for Ayres, reduced prevalence of schizophrenic symptoms, and ultimately re-engagement with society. Some potential concerns arise with detachment in the support network and complications with the medications. Ayres has already demonstrated he develops significant attachments to people in his life, as exemplified by the incident with Lopez in the apartment. If an individual in his support network leaves, he will likely be adversely affected, potentially leading to relapse. The atypical antipsychotic medication comes with several side effects, including weight gain, increase in blood sugar and cholesterol, and decreased white blood cell count. However, if Ayres does not maintain strict adherence to the dosage schedule prescribed, there is a strong likelihood the medication will not have the intended effect. Additionally, the risk of relapse will significantly increase. Based on the descriptions in the DSM, this film was an accurate depiction of schizophrenia, including its symptoms and its effects on those closest to the patient. All the symptoms shown in the movie aligned well with those described in clinical literature and were presented in a realistic and thorough manner. The film truly looked into the life of its subject, the real-life Nathaniel Anthony Ayres Jr., and presented his life and struggles in a way that allowed the character to be understood and related to rather than stigmatized. This film is a more positive representation of how Hollywood influences society's views on mental illness as a whole. While this movie successfully showed a person with a crippling psychological disorder encompassing Nathaniel with his experiences and personality, films can be too prone to showing a disorder as a stereotype via two-dimensional caricatures. This type of portrayal is detrimental to society's understanding of a significant portion of itself and only serves to perpetuate the stigma on mental illness. However, when people with illness are shown comprehensively, as Nathaniel is in The Soloist, viewers are afforded insight into his life.